Hi everyone. Recently, I had the privilege of attending the Muscut Health Exhibition and Conference. Among all the incredible experts, one figure stood out, Dr. V.M.Thomas, a world-renowned fertility specialist and an award-winning beacon of hope for couples worldwide.
This is Dr. V.M.Thomas, IVF scientist and specialized in ICSI treatment. So I have been working in this field almost 26 years. We have helped to deliver more than 65,000 IVF baby worldwide. We have patients from all over the globe.
Dr. Thomas is not just a miracle worker. He is an award-winning scientist in fertility treatment, recognized for his significant contributions to reproductive medicine. As the founder of CFC Super Speciality Hospital in Chennai, Dr. Thomas has helped deliver more than 65,000 babies, fulfilling the dreams of countless couples around the world.
And in Muscat also, nearly 1,000 patients we have delivered. And most of them are 80% twins and single and triplet also we have.
For many couples, the journey to parenthood is a painful one. The heartache of multiple failed treatments, the endless waiting, and the fear that they might never hold their own baby in their arms. It's an overwhelming emotional and physical challenge.
Even if you think that there is no sperm, even few sperms is there, 5-6 sperm also, sure the person can become a father. So nothing to worry about it. We have male infertility treatment, we have female infertility treatment, we have combined for them. Advanced treatments are available in the Chennai Fertility Center.
But there is hope. Couples from all corners of the world have come to Dr. Thomas, desperate for solutions after numerous failed treatments in different countries. His knowledge, care, and groundbreaking treatments have restored hope where it was once lost.
Many patients are coming from Muscat because they are going to Jordan, they are going to Egypt, they are going to Turkey, and they are also going to other Lebanon, other place, and they are not getting pregnancy, and they all will come with a big fight, and most of them are either AMH is very low, or maybe the low sperm count, or maybe they are azoospermia cases. They doesn't have a sperm. So we need to do a PISA, or maybe testicular biopsy, or we can do a micro tease and take out the tissue, select a sperm from the tissue, and go for woman for IVF treatment. And so if you do properly, most of the patients they get pregnancy. The only challenge is, more than 40 years, if the woman comes, is a challenge for us. For them, we have a special treatment called as a stem cell therapy or PRP. So stem cell therapy means behind the backbone, and we take the, a fluid from the bone, and then we purify it, identify only stem cells. If there is no sperm, so we can directly inject into the testis. And then after 3 months, we can recheck it, or we can do a testicular biopsy, and the patient respond, and we'll have a sperms. At the same time, if the woman is more than 40, the ovaries are very quiet, they will be sleeping mode, and their AMHs are very less, like a 0. Something like that, 0.01 or 0.116, something like that. So those type of patients, we take a stem cell from the lady and then purify it. The stem cells can be directly given to the ovary. We inject in different directions, and then we also give vitamin tablets, and as well as other antioxidant. They wait for 3 months, and then we'll recheck it. Most of the patients, they respond to the stem cells or PRP. Same thing in men also, they're suffering from azoospermia or severe oligozoospermia. This type of treatment will help them to achieve a mother or father. So most of them are they are coming to our clinic, and we are giving one of the best treatment in our clinic. The worldwide their patients are coming. We are one of the leaders in pioneers and leaders in IVF treatment, and they are coming from Africa, as I mentioned that Sri Lanka, Bangladesh, and then Europe, almost all the place they are visiting Chennai Fertility Center. It's one of the best IVF center in Asia. So they can definitely come for the treatment. There will be a hope. So people are thinking that 40 and above or 45 and above, there will be no hope. but definitely there is you should not shut down. There is a hope. Definitely we give all advanced treatment in Chennai Fertility Center they can achieve. We have ovulation induction, we have IUI, we have IVF ICSI program, we have ovary regenerate, and we have a stem cell therapy, we have PRP therapy. If there is a endometrium is very poor also, we have endometrium also we can give the stem cells therapy in the endometrium, so thin endometrium also can become a good endometrium. And repeated implantation failure also we focus in our clinic. We analyze the woman and we analyze the men, and then we find out where is the chromosome problem is happening. So we check the chromosome. According to that, we will treat the patient also. Some patient have a repeated, a failure or repeated abortion, like a 5 times, 6 times, 10 times. They're getting pregnancy around, a 5 weeks, 7 weeks, 10 weeks, or 12 weeks. They're losing the baby. So when you check them, they will have a, a chromosomal abnormality. For them, we screen the embryo. We can find out whether euploid embryo or aneuploid embryo. So if you collect 5 eggs and 5 embryo, we check all the embryo, like a 1, 2, 3, 4, 5. So whichever embryo is normal, those embryo will transfer. If there is an abnormal chromosome, we discard. So we have all the advanced treatment. So here we identify either aneuploid embryo or euploid embryo. Aneuploid embryo is not useful for transfer. Euploid embryo we may transfer. So when you do this, there is a repeated implantation failure, a repeated abortion, we can save from them and they can achieve a healthy pregnancy. So like this, we have so many advanced treatments. And some patients have fibroids. So you don't require to open myomectomy. We can do a laparoscopy. We can remove the fibroid without any surgery. It's called as a keyhole surgery. Sometimes patients have a polyp in the uterus. We can also do a hysteroscopy without any surgery. We can put a small camera inside and we can take out all the like a polyp. The endometrium can be cleaned and then they can achieve a pregnancy. We will also have an endometrium like a bicoordinate uterus or unicoordinate uterus, or maybe shape abnormality in the uterus. We can also do a hysteroscopy. We can do a cavity correction. So these are so many advanced treatments we have.
I have witnessed the joy that Dr. Thomas brings to families. Parents who once believed that becoming a mother or father was impossible are now proudly showing pictures of their beautiful babies. Smiles, laughter, and tears of joy fill the clinic as dreams become reality.
So I have handled so many difficult cases. I have given so many live birth also for the repeated IVF failure patients. So CFC is one of the best for the fertility treatment. It's a super specialty hospital. In one roof, all the advanced treatments are available. You don't require to worry, you don't require to panic. When you come here, you will not go with the empty hands. Most of the patients go with the healthy baby. Thank you so much.
At WeCare, we are committed to helping you connect with Dr. Thomas and his team. If you or someone you love is facing challenges in starting a family, let us be your bridge to hope and happiness. Contact us today to learn more about the incredible fertility treatments offered by CFC Fertility Center and begin your journey to parenthood.